was very scary. Happened all pretty fast. I had just had a screening 3 months prior, my regular yearly screening, and that was all clear. And then I was having some pain and kind of got to feeling around, found a lump on my own, and went back for some additional films and found out it was cancer. Started doing internet searches, and of course Methodist has a wonderful site, and got on there, and through some other people that I know at work, got referred to a support group. And then at that support group, I got more information, more resources, and then my oncology research nurse gave me a lot of resources too.
I think most cancer centers have a variety of services, but not every cancer center has a holistic set of services that anyone can access, with all of the practical issues like finances and legal and job security, the emotional issues that people face, the hereditary cancer risks, diet, nutrition, exercise, all of that. And the other thing that's pretty unique about it is that people can access at least the initial services in any of those areas without any additional cost, and that's a huge relief to people when they're in the middle of cancer treatment.
I'm active in support group here, the breast cancer support group, and then I also participated in the 12-week Time to Heal program. Very active with the Flamingos group that came out of our breast cancer support group, and they're funded too by Harper's Hope. So
all of us in Harper's Hope have developed expertise in our various areas, both through our training and through our experience. And when you're presented with a brand new experience like cancer is, why would you want to take extra energy to go out and reinvent the wheel? And I believe that everybody is pretty resilient, and most people will find their answers over time. But if someone can just tell you the shortcuts and give you the benefits, and it's free, why wouldn't you use it?
You know, I went there, like I said, when I was I was tired. Probably was at a point where I just didn't think I could do it anymore. My greatest worries were, again, getting sick and not being able to work, not being able to take care of my family, and what they were going to do without me.
Whether you're a patient or a family member, there are concerns and issues that you have that you may not be able to discuss with your loved ones. The advantage of coming to the Behavioral Health Service is that you have an objective person who really can help you process through those feelings.
You know, it helped me turn my thoughts around and realize that it was okay to focus on me and my well-being, because that was not something I was comfortable with. You know, as a mother and a wife, you're always focused on everybody else. You know, I don't have to be Superwoman, and I don't have to be great at everything to be happy.
When treatment ends, people begin to feel their feelings, and a lot of times that's a huge anxiety, because up until that time you've been seeing your doctor and your treatment team every week. All of a sudden, when treatment ends, you might go several months in between doctor's visits, and you want to know how you can get back into feeling well again. And that's a lot what we do in our post-treatment survivorship programming.
The program was great to help you transition back into life. And it was a lot about what's that life look like now, and how to make the best life.
One of the things that cancer does is it strips away all of the pretense and all of the superficial things that don't matter, and people are so real. They talk about what they love and what they live for, and those are the best conversations that you ever have with someone. And if there's any way that I can help them have a better life, regardless of where they are in their cancer journey, and help them do a little bit more of what they love to do, then that really makes my day.